This is CGTN, China Global Television Network.
Tunisia's Ministry of Health says it is preparing for a possible fifth wave of COVID infections. The ministry says it has provided more ICU beds and increased oxygen supplies to health institutions across the country. Adnen Chaouachi has more now from Tunis.
Dr. Heshmi Louzir heads the COVID-19 vaccination campaign in Tunisia, as well as the Pasteur Institute in the capital, Tunis. He has warned that infections linked with the Omicron and Delta variants are increasing across North African country. He says people need to observe preventive measures as the country faces the possibility of a fifth wave of infections.
This new wave of infection started in Europe and has reached its peak. It's mainly caused by the spread of the Omicron variant globally. The Delta variant is also present, but Omicron spreads more rapidly in Tunisia. The health department is well prepared for the new wave, and we have provided oxygen and ICU beds at hospitals.
Have urged the government to take several measures to limit the spread of the virus.
The main recommendations are imposing a nighttime curfew and a 3-week ban on cultural gatherings, sports and cultural events to break the chain of infections with this fast-spreading Omicron variant, and this will prevent the fifth wave outbreak. We have also called for stepping up of the vaccination drive.
Tunisia is preparing for the fifth wave of coronavirus by increasing vaccinations countrywide. More than 6 million Tunisians have been fully vaccinated, even though many others remain reluctant to get their first dose.
Everyone should get vaccinated. It's safe and it saves lives. I have my vaccine certificate. Tunisian citizens must behave in a more responsible manner and respect the law.
I'm old and retired, but I refuse to get vaccinated. It's my body and I'm free. Imposing vaccination limits my freedom as a citizen.
Tunisian groups opposed to inoculations have organized several protests to denounce mandatory COVID-19 vaccination. The Tunisian government is trying to increase public trust in COVID-19 jabs. According to the health ministry, Omicron infections now account for 30 to 40% of cases undergoing genome sequencing at the Pasteur Institute in Tunis. The Delta variant represents around 60% of infections reported in the North African country. Adnen Chaouachi, CGTN, Tunis.